So let's begin with today's topic, which is knowing exactly what are the other factors which have the potential to influence pain. We've been long discussing that, the longer the pain stays with you, less is the relationship with the tissue damage, or it does not mean hurt is not equal to harm. That is what we've been discussing over a period of time. So, exactly, if there is no tissue damage, if there is, uh, then why are we getting pain? And this is what is going to help us know exactly the probable factors which could be contributing to your pain apart from a structural bias. Okay. So, pain influencers, we call them as pain influencers. If they are able to produce pain, we call them as negative pain influencers. And the factors which help you get over the pain are called as positive pain influencers. Now, we've been repeatedly telling you this that individual's experience of pain is unique to that person, but it is not just a sensory experience. The pain which the person experiences is dependent on on the situation, the context, what is the environment for that individual, what are the interpersonal relationships, and what does that specific experience mean to that individual. Hence, we use a lot many times. Hence, we use biopsychosocial model to explain pain, right? So these factors which have the potential to influence pain either in a positive bola to it will help you improve or help you get over the pain, and negative influences which trigger or potentiate an ongoing painful process. Now we divide pain influences for the ease of our understanding into these categories: cognitive, emotional, social factors, physical factors, and lifestyle factors. We're gonna deal with each one of them in detail, and then probably we'll be able to understand what exactly happens when you are in pain. Now, cognitive factors. The foremost factor that we have related here is the negative beliefs. Okay. Now, you have to understand that belief has a profound effect on the way a person experiences pain or is able to cope up with the pain. So, belief, understanding what is it that the person believes has probably led to their pain is very, very important. And when we discuss about the belief in the last presentation, we have given you the questionnaires. So we try to explore. We ask them what exactly has led to this pain according to you. Okay. I am sorry every time somebody is coming in.
Pradnya ma'am, I'll be entering people. You continue with your presentation.
Yeah, thanks. So that is when we need to understand what are the beliefs that they have. So if somebody comes to you with a low back pain and says that I believe my low back pain has caused because I probably lifted something heavy or I did a deadlift in the gym, because of which my low back pain has been triggered and I should not be lifting weights in future. Okay, then you understand how you are going to target your treatment. You have to reduce the effect of that belief on that individual, educate that person. So, using the belief questionnaire to understand what is the frame mindset for that individual will be very, very helpful. Now, we come down to the next factor, which is very widely used but less understood, I would say, which is catastrophizing. Now, we've been using this word, this terminology a lot as far as our even chronic pain patients are concerned. Okay. And what does the word catastrophizing mean? Catastrophizing is over exaggerating. Okay. So you've come across a person who would think the worst possible scenario for his or her pain, keeps on dwelling or repeating the same thing. The thoughts are always there with him, and he will, put a minor problem. He will portray a minor problem as a major calamity for that individual. Okay, for his pain. We've seen many a times people who come to you with. I had an individual who was 28-year-old having been diagnosed as a disc case, and his wife and he firmly believed that he should never sit on the floor or never bend forward. And anytime he had to lift anything, he would bend from his knees and then try and lift it up. He wouldn't carry his child, a 1-year-old child. He wouldn't lift even a grocery bag, which is 1 kg. This is over exaggeration. He thought that any amount of stress would lead to a very bad issue and he would land up in paralysis. That is catastrophizing. It's a cognitive problem. Okay, their thoughts are disturbing the process. And when catastrophizing behaviors are entertained or they are, not being managed well, they lead to a lot of emotional disturbance. The person then starts becoming hyper vigilance, which is our next category. The person starts becoming hyper vigilant. Now, what do you mean by hyper vigilant behavior? Overcautious. So, I have had back pain or I have knee pain. I will never climb stairs. Okay. Or I have been told not to sit cross legged. That is overcautiousness. So, because the catastrophizing behavior has been entertained over a period of time, or nobody has taken efforts to educate them, the hypervigilance sets in. Once the hypervigilance sets in, the person becomes fearful of movements and starts going into something called as a fear avoidance behavior. The person will start avoiding those specific behaviors which are dangerous for him. We discussed about danger in me and safety in me in the last presentation. So all of these factors which the person believes are the cause of pain would be avoided by that person. Now, once this avoidance behavior sets in, what it leads to is the low self-efficacy. Now, to understand low self-efficacy, I think it is very crucial to understand the word self-efficacy. What do you mean by self-efficacy? Self-efficacy is probably your ability to perform a specific task with a successful outcome. So, if your patient is a 35-year-old IT person, his self-efficacy would be he should be able to sit and work for say 8 to 10 hours, travel to his office, come back, take care of his family. That is self-efficacy for that individual. But because of his back pain, he just starts avoiding sitting. He starts taking leaves from the work. He starts avoiding going out or playing with his kid. Then he becomes a can't do person. A can't do person, matlab people start isolating him, and then he develops a low self efficacy. He is not confident enough to believe that he would be able to get out of his pain on his own, or there is help available. So, understanding the cognitive factors is a very crucial part of treating a person with pain, because these are the factors which are inherently been ingrained into them. These are behavioral factors which probably would need, you may not be able to manage it at your level. If the catastrophizing and hypervigilance is so high that the person is just not ready to do anything, then probably they also need some amount of counseling or cognitive behavioral therapy. So, recognizing at which point is your patient. If the person is just at negative beliefs, you probably would think that yes, I can bring in a difference. Catastrophizing initial behavior है. Identification of these behaviors is very important. That is why we are discussing these factors at length here. Okay, so that you know why the person is not getting better. It is not always because the person is malingering or is, attention seeking, but these behaviors are have become a part of their personality, and you need to understand them, recognize them, understand, and then manage them if you want to get over their pain. Okay. Moving on to the emotional factors. Now, majority of these emotional factors are a result of the cognitive factors, as we discussed. अगर वो हर चीज को बढ़ा चढ़ा के सोच रहा है, if every stupid thing that comes on his or her way is dangerous for them, then of course it leads to fear, it leads to anxiety, it leads to frustration because they are just not be able to get over their pain. They're not understanding why are they so cautious and why are they always in pain. So there's a anger. Depression sets in. Okay. And avoidant coping responses we discussed in the cognitive factors only. Now there's a very good amount of differentiation which you should understand between fear and anxiety. I have uploaded that article on the Google Drive, and it's a very nice article by American Pain Society. Okay. Now, what we always say that fear and anxiety, depression are all falling into one category. But fear is something which is a present oriented factor. Okay, मतलब वो आज है. I am fearful of running because I have knee pain and back pain. I am fearful of squatting because I have OA knee and I have been told that this pain will become bad if I continue to squat. Whereas anxiety is a future oriented emotion. Okay, मतलब वो आगे का सोचेगा. Person starts worrying. Anxiety is worrying about a particular thing. So when you are worrisome, you would start thinking that yes, my doctor has told me not to sit on the floor because it will exacerbate my knee pain, or because I landed up with a shoulder pain, I should not be going back to my bowling. Okay. But my physios told me this, but I'm not convinced. My physio is trying to tell me that I would be able to get back to my normal routine, provided I follow certain guidelines. But I keep worrying. I am anxious because I feel that probably if I don't listen to the doctor, then this problem might just worsen and I might end up having a surgery and probably would never be able to move my hand. That is the reason, again, understanding what is the emotional context with which the individual has come to you, and then programming their rehab by taking into consideration the factors will help you a lot. Okay. Social factors. Uh, we are in the same article. I found this very nice line. People do not live in. They do not exist in isolation. Okay, and we are always surrounded by people. We love to be a part of something, belonging somewhere. Okay, but again, these societal factors, societal concepts, certain cultural issues can have a negative impact on your life. Okay, now how about poor health literacy and low socioeconomic status is usually more or less found in developing countries. And people, again, with these two predominant factors, would come to you with a lot of negative beliefs. Okay, as we discussed in the first session, when we used to visit in the rural areas of Panvel, and people would say that because they have bad blood in their bodies, they should not be exercising. Exercises are going to increase the proportion of bad blood in their body. Negative belief bought out of the cultural influences on the people, and everybody in that village would just manage the pain, bear the pain, but they would not exercise. Okay. Then you have life stresses, even in emotional factors, stress. So this stress here, which I missed earlier, is probably a combination of, your physical and mental stress. But what stress does is basically helps you produce cortisol. Okay, you are always into a sympathetic zone. What does your sympathetic zone does to you? It always keeps you ready for a fight or flight mode. So you are always in a survival mode, I would say, because you start seeing threats everywhere. So if it's an occupational stress, if it's a lot of physical stress, you're overworking. If it's a mental stress, you're not, we come to lifestyle factors, but you're not sleeping enough, you're not resting enough, there's a financial burden, and the pain is not allowing you to be productive enough in the society and community, and you are isolated. These are all factors which will negatively impact your pain. Okay. Physical factors. So once you have hypervigilance, you have a catastrophizing behavior, you become somebody who is avoiding movements, who is avoiding activities. The foremost thing that happens with this is deconditioning. Okay. Because probably just before the onset of pain, you used to go for walks, you used to do gardening, you used to enjoy playing tennis with your son, and all of a sudden, one fine day, this back pain comes up or knee pain comes up, and you just slowly start limiting your activities. Your body is going to decondition. We discussed the sympathetic responses because you are so hyper vigilant, you are so stressed. The all the hormones which are responsible to be there for your fight or flight responses are always present in the body. You're never calm, you're never relaxed. You're always on the edge, on the nerve. Okay. And then what this does is it provocates certain behaviors which you would probably not be provocative functional behaviors. Avoidant behaviors aa jate hain. You do not have a good coping strategies, and then you start avoiding even the baseline functional things that you are supposed to be doing. Like I had an experience of a person who was pretty young, had back pain, disc tha, पर they did not even allow him to get up and use the washroom. Okay, the family was under the label of being supportive, was giving bedpan to the patient. Okay, or a TKR, knee replace spine surgery patients. They tell these people to use walker for a month or month and a half after you have stabilized the spine. Okay, we can wait for 3 weeks, 4 weeks, whatever, but the walker should not be continued. So the functional behaviors, you start maladapting the functional behaviors. We start ignoring certain factors which are very crucial for your healthy being. Okay, like having a good nutrition, doing a lot of exercises which are in a way going to be helpful and getting you more and more functional and helping you to be better. And we come here, which I feel, along with the cognitive factors, your lifestyle factors are something wherein you can try and bring in a lot of change right from the first sitting. Okay. We are all sedentary. We are all nowadays, since the pandemic, we have been majority of them are still, leading a sedentary life because the activity levels have gone down considerably. We are very erratic, as the first point says. We are either completely zero on our activity, or one fine day we just get up and decide कि आज तो exercise सब करना है. So you directly hit on to HIIT, okay, high intensity training. And then you are completely down with pain, and then you blame the exercise for the pain. Okay. Now, coming to sedentary behaviors, we discussed, but poor sleep. Now, this is a good thing to discuss because we always tend to ignore importance of sleep in an individual's life. Now, this is a very controversial thing whether the sleep has come first as a problem, like my pain has emerged because I'm not sleeping enough, or my sleep is disturbed because of my pain. It's very, very difficult for us to put our finger on which has come first. But understand that your sleep and pain have a reciprocal inhibition. Vice versa. You probably might be sleeping very well before the onset of pain, but once the pain started, the disturbing thoughts started, and your sleep slowly, slowly started going down. You probably were not comfortable lying flat on your back, or you were somebody who was sleeping on the right side, and now the right shoulder is hurting, so I've been told not to sleep on the right side. Okay, or you are probably a belly sleeper who used to like to sleep on the tummy, but the doctor said no because of the pain. Now, all of these factors, what they do is, if you're not sleeping enough, your alertness starts going down. You start feeling very irritable. Fatigue आ जाता है. You are a bit anxious probably, but more or less the cognition levels go down. Now, once the cognition levels go down, your one side effect of this is definitely your efficacy to work or to perform a task starts going down. But what poor sleep also does is it helps bring in inflammatory mediators into your system. Okay. So if you are not sleeping enough, of course you are irritable. Because you are irritable, some amount of stress hormones are circulating into your blood, and cortisol has a great potential to bring in your all the inflammatory mediators, bradykinin, prostaglandins, all of those are just circulating in the blood, in your system, and then the pain will never go down. Okay, so understanding that probably uh, the persistent pain with which the person has come to you, or something that just goes on and off and is fluctuating a lot, please remember to ask, are they sleeping enough? Okay. Because if they are not, then there are ways in which you can help them understand the importance of sleep, and probably some ways wherein you can, guide them. So I'll discuss about that once we finish all the factors. Now, coming back to obesity, because we are sedentary, because we are low onto our physical activity levels, we tend to put on weight. But there are few people who are genetically obese. There is no way in which they are able to just control their weight. I have a person who is absolutely overweight with badly screwed up knees, and the poor lady is trying literally hard to reduce the weight, but it just doesn't go down. Now, overweight and knee pain, we already know the combination, how bad it is going to be mechanically also. But obesity, apart from direct influence on the biomechanical aspect of pain, also has the capacity to keep the inflammatory mediators into your circulation. Okay, and so does smoking. So that's why we advise people certain lifestyle modifications wherein they have to try and get at least a kilo or two down if they want to set in some relief in their pain. Okay. Now that becomes very difficult. And what happens with majority of these patients, because they are not able to lose weight, or they've been hanging on to that high weight for such a long time, if you start probing them, पेन कम करना है तो वजन कम करना है, पेन कम करना है तो वजन कम करना है, नहीं होगा, and you will again make them more frustrated, more angry on themselves, and they will get more into depression and more catastrophizing behavior. Okay, so how do you guide them is, yes, your probably weight is one of the factors which is probably coming in the way of getting pain, getting you for you not being able to get over the pain. Okay, but let us right now focus on just exercising. Let us not keep reducing weight as a goal. Okay, the more you get them moving slowly, graded exposure में धीरे धीरे as you increase their activity, slow and steadily introduce diet as a factor, these people will start complying. And as we all are aware, normal exercises with no specific ऐसा कुछ protocols also have a capability of introducing endogenous opioids. Feel good hormones are produced a lot when you are exercising, and that itself helps to make the person um, have a better outlook towards their pain. Okay, smoking definitely a big no and has been having a lot of negative impact on the pain. Now, nutrition and hydration are again the most underrated factors when we talk about people with persistent pain. And that is because we do not actually focus. We all are eating junk. We all are one fine day when we realize that, nahi, this is adding up to my weight, forget pain or no pain. But we suddenly shift to vegan diet, then we shift to keto diet, then we have protein, I don't know what other diets. But somebody does intermittent fasting. But we are not paying attention to the normal nutritious food that is usually being made at home, and we're not eating that. Okay, so I was talking to one of the patients who had come to me, was 25-year-old with degenerative changes in his spine, and was reported on the x-ray, and the family was a lot scared. He all of a sudden 25 made degenerative changes kaise aaya, and what all things have gone wrong, whether my son will become crooked and all of that. And then everything was normal. He was able to bend, he was able to move. He was like, I just get pain at the end of the day when I'm about to hit the bed. And then we dug into everything. He was overweight. He reduced his weight by some good 10 kgs. So that was not a problem. He didn't have any addictions. Okay. He was sleeping good. Because he lost weight, he felt good. He was exercising enough. When we came to the factors of nutrition and hydration, we realized he's not having enough food, okay, enough healthy food and enough water. Water becomes something which is helping you to reduce the toxic chemicals from your body. Hydration is very crucial for your muscles, for your entire system to stay healthy. So because he was a Maharashtrian patient, I told him, we all Maharashtrians have a concept of varan bhat, poi bhaji, and then some salads and everything in the plate that a normal Maharashtrian thali consists of. I think was there because of a particular reason, and we deviated from there, and then we started having a lot of junk and not focusing on having good food. So ask your patients. If all of the factors you ruled out, then please ask this about what are they eating. Okay, it's not something like they shouldn't be having junk at all. Cheat days are always there, even for diabetic patients. So you can definitely focus on good food for say 5 days, and then remaining 2 days you can tell them that you can probably have a burger or a pizza. Okay, insist on having water. Currently we are into a zone where the temperatures are, अगर गर्मी है तो बहुत ज्यादा गर्मी है, and we don't realize that 2 days there is cold weather, and then suddenly next 2 days there is extreme heat. So when these temperatures are varying so much, your body doesn't get enough time to adjust. Majority of our pain patients would ignore their hydration. I ignore my hydration and I always end up with migraines because of that. Okay. So hitting on to these points in the lifestyle factors, these are the things, which you just talk it out and explain them the importance. They are easily manageable. And then you would start understanding that the person is actually getting better. Okay. So, you have to realize this, that musculoskeletal pain, when it is persistent, can become predictably unpredictable. You can't put your finger on what exactly is causing this pain or what exactly has exacerbated my pain suddenly. Okay, tissue is one factor, but now we have confounded so many other factors. Please keep a checklist of these factors whenever you're taking your history. Okay, because your negative pain influencers have the potential to trigger existing pain. Understanding of these factors is very important for better management of our patients, because if we know that the person is not sleeping enough एंड वी कीप ऑन टारगेटिंग कि प्रोबेबली यहाँ पे स्कैपुला का पोजीशन चेंज करके मैं देखूंगी एंड माय हैंड पेन विल स्टार्ट गोइंग डाउन, माय शोल्डर पेन विल इम्प्रूव. नहीं होगा. If the person is not having enough water, if the person is not sleeping well, if the person is not being physically active, probably these are the factors. If you've not tackled, understood the catastrophizing aspect of the person's behavior, and if you have failed to understand why the person is on low on his self-efficacy, how much ever physiotherapy you do, probably the rehab might be most advanced, updated rehab, but you are not going to get 100% result. Uh, Educating patients about the pain influences reduces their anxiety and definitely helps them develop better coping strategies. This is something which we realized once we started taking these pain education seminars for our patients. Sit with them when you're taking your history. That's why those questions have been given to you. Understand the influence of each question and understand the influence of each of these factors, and then you probably would be able to develop a good coping strategy for your patient. Okay. So what we're gonna do is here we've discussed about the influencers, and I have already shared on the drive about the ways in which our understanding of the ways in which we can make a difference into those factors. Now, lifestyle we discussed a lot. Poor sleep के लिए, as I said that I would be explaining you later. So we generally tell our patients that an hour or half an hour before your sleep time, bedtime, please do not have active screen, mobiles, Netflix, TVs, Amazon Prime, everything has to be shut down. Okay, you can probably read a book that makes you fall asleep very fast. Keep the room dark, light nahi rakhna hai. If the sleep breaks, and understand it is very important for you to make your patient understand that बीच बीच में नींद टूटना is normal. At least 3 to 4 times every one of us wakes up. But yeah, majority of these people find it very difficult to get back to the sleep pattern again. So what you tell them is, get out of your bedroom, go out, probably take a book, sit there. You will again start feeling asleep. Come back to the room and sleep. Don't keep tossing and turning in the bed then and there. Because if you are not able to sleep, again anxiety trigger होता है, फिर उससे stress बढ़ता है. So these are few of the tips, and we have listed a lot many other things into that handbook. When we understand the emotional and the cognitive factors and the ways to deal with them. नेगेटिव बिलीफ है तो एजुकेट करो, कैटेस्ट्रोफाइजिंग और हाइपर विजिलेंस है तो प्लीज टॉक टू देम. Once you talk to them, you try and understand what is probably affecting them, and then you know probably you are able to get an entry into the person's mindset and bring in a change. Now, catastrophizing behaviors are very difficult to deal with. As I discussed even in the first the slide itself, you might need a lot of help from the counselors, and please feel free to explain this to the person. Once you've done your fair job about educating the person and trying and explaining, and in spite of doing everything, you are not getting the desired result, then the person should go and see a specialist in that field. Okay. Now, we are on the second webinar today, and there's one more about exercise prescription in pain. How do you make a person in pain exercise, or what are there any specific strategies that you would like to have whenever you are giving exercises for a patient with musculoskeletal pain? That would be our last one. So we've discussed this even in our inaugural seminars that जिसको भी यहाँ से आगे after the third seminar wants to have the certificate of the Pain Collective Educator, that person has to attend the three seminars on pain education. You guys have to attend and be an active part of one of the community programs which are organized by Pain Collective. So either by Yuvraj or me, wherever we are taking these community programs, you guys have to attend that and then help us conduct one such program. So you yourself will be conducting one such education program once you have experienced this session with us, uh, within either in your college or in your residence. Okay, so if you're fulfilling all of these criteria, then we term you as a Pain Collective educator, and you will be given a certificate for the same. Okay, I am conducting one on 19th of February in Mulund. The details of which, for those who are interested, can contact me and I'll share the details about it. Now, the next session about movement restriction in musculoskeletal pain on 16th Feb. Any questions?